I don't see any hands raised. Anybody with heart disease? Or know anybody who has it? No one? Okay, let's find
My
out who
my
gets.
my mother.
Thank you so much for sharing. Your mother has it. Okay. My dad had it. Both of my parents had hypertension, high blood pressure, which is, one of the factors, one of the kinds of heart disease that we're going to learn about today. Okay. So, who gets heart disease? Men are more likely to have a heart attack than women at an earlier age. But guess what? It affects both men and women at the highest rates in the United States. Statistics show that the number one killer of any disease in the United States is heart disease, right? And this is why we are here today, to find out the people who get it and how to reduce the risk factors. So we're going to move on to our next slide. Now, cardiovascular disease is the term for all heart diseases that affect the heart and the blood vessels. Look at the picture to your right of the screen. What do you see? That's the heart. That's part of the heart. Those are arteries. So, arteries are like the little electrical wiring of the heart. They surround the heart and they protect the heart. And so, if anything goes wrong with the wiring system of the arteries, then it would directly affect the heart. Now, on this slide, it says that coronary artery disease is also known as a clogged artery. And once an artery is clogged, it can cause heart attacks, strokes, heart failure, or a peripheral artery disease. We are going to find out all what these terms mean. But make sure you know that 1 in 3 deaths in the United States is caused by heart disease, which means more than 800,000 people die of cardiovascular disease every year, according to the Centers of Disease Control. And according to Dr. Jonathan Bernstein, who's a medical doctor, most of these are associated to lifestyle changes. Why? Our lifestyle has a lot to do with this. There are certain factors that double your risk for heart disease. I would name 5 top factors. Number one is smoking. The second one is cholesterol, high cholesterol levels, processed carbohydrates, and also poor physical activity levels, being overweight or obese. All of these can lead to someone having abnormal cholesterol, abnormal blood pressure, and that puts you at very high risk for diabetes. So if you look at the picture closely, one artery is open and blood is flowing through it, which makes it look red, but the other artery with the arrow on it looks clogged. There's no more blood flow in it. So coronary artery disease is that blockage of that artery. When the arteries are blocked, we think about what blocks them. There is a substance called plaque. Plaque is a combination of cholesterol that sits in your arteries. So over time, it clogs the arteries, and a buildup of plaque, which is fat and cholesterol, narrows the heart's arteries. These arteries are also called coronary arteries. And so these arteries deliver blood with the most richest form of oxygen to the heart. They help the heart have the nutrients to perform the job of pumping. Many people don't even know there's a problem until the artery is clogged. and that's how you have a heart attack. But there are warning signs that come before a heart attack, and we're going to learn about that. The most important one is chest pain, which is also known as angina. We are going to move to the next slide. Now, look at that diagram of the heart. The heart attack I'm talking about looks like this picture. Mention heart disease, and most people picture the heart as this, but the term covers several conditions that can hurt your ticker and keep it from doing its job. These include coronary artery disease, arrhythmia, cardiomyopathy, and heart failure. And I will break it down to you. When the arteries are blocked, that damage can also occur at the level of the the um the heart, where the arteries meet and provide that electrical rhythm. So the wiring of the heart has something to do with some electrical conductivity, right? Once that part is damaged, your heart begins to have irregular heartbeats, and those are called arrhythmias, sometimes dysrhythmias. And sometimes, if the damage occurs to cause inflammation, that's called cardiomyopathy. That's an inflamed heart. Sometimes the damage just makes your heart not pump enough, and that's called a heart failure. It doesn't mean that you don't have a heart that works, you're going to die, but people who have heart failure just have a very weak force of pumping. Their heart can no longer pump enough, and that's why they would need a little help, like having a pacemaker. And if your heart cannot pump very well, you might end up with a lot of fluid sitting in your lungs and in your legs. And that's why there's swelling. Okay. So for heart failure patients, we we try to manage them by weighing them daily so that we can tell how much fluid is retained. So that's why sometimes we have orders like weigh yourself daily. And to weigh yourself daily, you are to do it right after you wake up from bed and urinate. Right after you urinate, before you eat, make sure you take your weight. Okay. Now let's move on to the next slide. The most important thing is to recognize the signs and symptoms of a heart attack. Because these symptoms are so subtle, you may not even know what is happening, especially for women. Women don't feel it as much as men. They may just feel very light signs, like they're having a menstrual period, that light headache and that stomach cramp, all those light symptoms. They might just get away with it, but actually, it could be a sign of a heart attack. So let's see what signs they are. You might have pain or pressure in your chest. Most patients come in and say, "Oh, I feel my heart hurts like an elephant is sitting on my chest." That is the cardinal sign of a heart attack. Discomfort spreading to the back, jaw, throat, or arm means the pain is radiating up toward the neck, jaw, throat, or the arm. And then you would have nausea, indigestion, and heartburn. Some patients have weakness, anxiety, and shortness of breath. And some people have fast and irregular heartbeats. When you feel this way, please report this immediately. It is an urgent case. You can either die right away, or most people have found others dead in their sleep without nobody knowing what's going on. We're going to find out in the next slide what we can do about it. Okay. How do we live with heart disease? Some types are long lasting. People can live with this for so long, while others cannot. At first, the symptoms can be hard to spot and they may not disturb your daily life, but if not paid attention to, they can get really worse. And if your heart starts to fail, you might be short of breath, and feel very tired. Now, keep an eye on the swelling in your legs, your ankles, your feet. In many cases, long term treatment can help keep things under control. And so you can fight heart failure with medication, lifestyle changes, surgery, and even a transplant. The other form of heart disease we're going to learn today is coronary artery disease. And that's just another name to refer to heart disease. About 366,000 Americans die from coronary heart disease each year. Deeping dive into it, what happens with coronary heart disease? It is the same thing. The plaque formation in your arteries, which is the accumulation of fat and cholesterol. Sometimes it's calcium and other substances found in your blood that build up to block the arteries. When your arteries are clogged, another name for it is called atherosclerosis. And this atherosclerosis can happen anywhere in your arteries. It could happen in the legs, it could happen around the heart. If it happens in the legs, that is called peripheral artery disease, PAD. We're going to talk about that later. Now, when this plaque forms, it reduces the amount of oxygen rich blood getting to your heart, which can cause chest pain, also called angina. Plaque can also lead to blood clots, which block flow and are the most common cause of a heart attack. And that's how COVID 19 is also kind of related. When the virus attacks the heart, if your heart already is at risk of having blood clots, it makes it even worse for you to have these blood clots and react to it even more. On the picture, you can see the plaque. It's a black substance on the heart. It shows the necrosis, the dead tissue. When tissues don't get oxygen, they basically die. And that's what it would look like. All right. In our next slide, we talk about fat deposits, cholesterol. In the picture next to you is the fat. Those yellow molecules are the fat cells. Look at what it does to your arteries. How do you know you have high cholesterol? There's a test the doctor orders called the lipid profile. If your fat is about over 240, it is too high. It puts you at very high risk for heart disease. We want it to always be below 200. Optimal is below 150 milligrams per deciliters. So your total cholesterol composes of two things: LDL, which are the lower density lipoproteins, and good, which are the higher density lipoproteins, also known as the HDL. So your cholesterol, some of it is good, some of it is not good. We call it bad cholesterol and good cholesterol. So when you do that test, the doctor will be able to tell which one is good, which one is bad. Okay? So it's always important to know your numbers. This test can be performed yearly at your regular physicals. So if you don't know it, you can still ask the doctor for a copy of your last year's result. They would always have this test there. All right, for your HDL, you want to aim for it to be above 60 milligrams per deciliters. And for your bad cholesterol, you always want that number to be less than 100. Now, if you look at that picture, you see how the fat is pressing on the artery? It actually causes that narrowing to the point where all that blood cannot longer flow. And that's why it affects your blood pressure. That pressure of the blood flowing in your veins is what we call the blood pressure. You are supposed to have a certain level of blood pressure. It should never be above 140 over 90. That's when you would need medication or you would need all kinds of lifestyle modifications, such as diet change, exercise, Some people, it runs in their family as a familial threat, meaning that it can be genetic. They just have a history of high cholesterol in their blood, and that's also called hypercholesterolemia. So the doctors can determine if that runs in your family, and then they will put you on, a regimen where you have to control it with medication until it goes down. On our next slide, we're also going to learn about another kind of emergency. When your heart is affected in this way, the arteries can actually bust. And that's when you have a stroke. This is a medical emergency. This can kill you in minutes. But there are some signs that you can tell that something is not right. All right, let's look at the picture. You can see the brain with the blood vessels to it. And when the blood vessels in the brain burst, or more commonly, when there is a blockage, without any treatment, this can just kill you because the brain needs oxygen to be able for you to think through anything. And so we're going to learn about the signs and symptoms of a stroke in our next slide. So, how do you know that your blood pressure is causing all these problems? Well, I told you about the number. A normal blood pressure should always be below 120 over 80. And those are two numbers that, as an adult, you have to know. The top number is the systolic blood pressure. It is also called the force of of the blood. When the heart is contracting, that force is usually 120. It should be below 120 according to the American Heart Association. And the lower number is the diastolic number, which is the force of blood through the artery when the heart is resting. Okay, it should never be above 100. That puts a lot of pressure in the heart. And so, knowing those numbers would save you. If you have a blood pressure cuff at home, you can immediately take your blood pressure and begin to figure out what is normal to you. And if it goes higher than that, you should begin to walk your way down to calling or walking your way down to the emergency room. So these are the signs and symptoms of a stroke. You can see in the picture a man with a drooped face. So the face drooping is a very quick sign. How do you know? If you see someone with this, you can ask them to smile. If they can't smile with their normal loop, symmetrical on both sides, then there's a problem, right? Now look at the arms. When you have a stroke, one arm gets completely weak. And that's because the brain is affected. Remember that brain picture? If the brain is affected, all those areas that the brain controls can no longer work. So if it's one side of the brain which controls the hands, the function, the mobility, that's how you know you're going to have weakness on one side because it depends on the side of the brain that is affected. So numbness is another sign. When you can't feel your hand anymore, there's a problem. Speech, your speech also goes away because maybe the blood clots have formed around that part of your head that controls speech. And then at this point, you can ask the person to say a word, repeat a simple sentence, and if they have trouble, they're slurring in words, that's how you know that it's time for you to call. Now, do not delay. If you don't make it to the hospital in 90 minutes, just a 90-minute window, you may not survive. Researchers have worked on this and they've given people that 90-minute window for them to be able to administer certain medications. So that's why we say time is a big factor. So a simple way to remember this is an acronym called FAST, act fast, meaning that we remember F is for face drooping, A is for arm weakness, S is for speech, and T is for time to call 911. So when you have any risk factors, you need to act fast. We're going to move on to another form of heart disease. Like I said before, depending on what parts of the arteries are blocked, if that damage occurs around your legs, the arteries around there are called peripheral arteries. And so it gives the name of the disease, peripheral artery disease. This occurs when the arteries in the legs harden up, they form deposits and narrow, also known as atherosclerosis. As a result of high cholesterol, high blood pressure, diabetes, or high triglycerides. So, these are all the things that may cause it. Some people even have this damage occur in their teens. So, a lot of this is associated again to our lifestyle, and that's why we are going to find out in our next slide what we can do, right? There are 5 ways to lower the risk for heart disease. 5 major ways. Number one, don't smoke. Smoking doubles your risk of heart disease. Control your cholesterol. Maintain a blood pressure above or below 120 over 80. Do not go above 140 over 90. If you do, you can lower it down. There are several ways to lower your blood pressure. You can start by doing aerobic exercises, weight loss, and also lowering the amount of sodium in your food. According to the American Heart Association, Americans eat 5 times more than the recommended salt. And so there's a DASH diet, which is also known as dietary approaches to stop hypertension. If you follow that diet, it helps you to cut back on your salt. Now, the next thing is to get more physical activity. According to the Centers of Disease Control, 60% of adult populations have an inactive lifestyle, which is equivalent to someone who smokes a pack of cigarettes in a day. And this puts you at a high risk. The last and the fifth one is being overweight or obese. This doubles your risk of heart disease. So, again, those 5 factors would all be something under your control that you can have the power to change. These are modifiable life factors that you can make to reduce your risk. On our next slide, we already talked about how this COVID-19 virus can also affect your hearts because even though it commonly affects the lungs, it can also affect your heart depending on where those fatty deposits are blocking your arteries. If the virus hits you, it makes it even worse. I have a small video I'm going to put in the chart. I don't know if we can watch it directly. I'll put it for everyone to see how COVID-19 affects your heart. And I will give you some resources on our next slide. So, how do we track our health stats to make it even better for us? Heart disease, now that we know it's largely a preventable disease, it is reversible. Yet, many Americans are still at risk for getting it. So, we need to make a plan to get healthy and track our progress. We need to be able to remind ourselves what is our blood pressure, what are our weight goals, what are our physical activity goals, and if we have diabetes, what are your blood sugars like? And try to keep a log of all these things. It starts from knowing your numbers. I have some resources in the chart Ms. Shaniqua is going to share with us regarding where else you can find resources for our programs. We do provide on our website, aahpmontgomerycounty.org, some resources for you to make these lifestyle changes. For example, we have virtual classes that hold every week. This month, we're touching on topics for heart disease, and we do hope that you can make use of those. We also have diabetes support groups because diabetes and heart health are directly related. And it's important for you to know your risk. You can take a test called the CDC Risk Test if you do not know whether you have prediabetes or not, just to kind of find out where your numbers are. Ms. Shonika has that information for us and we'll share it in the chart. And this brings us to the end of our presentation. If you have any questions, please ask. And thank you for having me.
Thank you so much for your outstanding presentation. Thank you. It's very, very helpful.
You're welcome.
I certainly agree. Very helpful.
Thank you.
Okay, bye bye.
Thank you so much. Ms. Shanuka has put a lot of